Hi, I'm Naomi Fenlon at Cosmopolitan Skincare Solutions. I'm going to show you how real professionals take care of getting rid of those nasty pimples on the skin. Please do not try this at home. Leave it to those of us who do this all day long for a living. If you try to do this yourself, you are only going to make a disastrous mess of your skin. There are real physiologic, anatomic reasons why that happens and why you're not able to do this to yourself. So put your skin in the hands of people who know what they're doing and let us take care of this for you. The first step in the process, in our office at least, typically is what we do is we use a device called the isolase, which using technology extrudes the collected tissue, oil, and bacteria that's stuck in the pore. And that's the first step with an extraction. That's what I'm holding in my right hand, and you'll see how this works in just a second. So turn it on, apply a little cold water to the surface of the skin. And you can see the patient. I'm going to just apply this right on the actual pimples themselves. So a little tiny bit of hot cold water. We apply the device, pulse it, and you can see right to the surface comes all of that collected sebum and everything else. And then there's another little one right next to it. We'll do that one as well. And the same thing happens. There's another one up higher on her face. We'll do the same thing up here. And you can see, although it didn't come out of the skin, it comes closer to the surface. Let's go over that one more time, see if we can make a bigger difference. And you can see how much closer it comes to the surface of the skin. Once that's done, I'm going to come back with an actual mechanical extractor with a little antiseptic on some very soft gauze, so I'm not doing anything abrasive on the surface of the skin. Under magnification so I can really see what I'm doing. I look straight down on the surface of the skin. I don't know if you can get a good view through the camera, through my magnification lamp. I'm going to start on the little one right here that actually came up with the device itself. You see I wiped away the top portion, press down, and out pops the rest. And that's gone.
How can you tell if it's all out?
Well, after doing, I don't know, probably several million of these, it's really easy. I can tell looking, I can actually see through the pore to see when there's nothing left in there. For people who haven't done as many extractions as we've done here in our office, it's a little bit more difficult. But there's actually a hole there. And you can see when there's nothing left inside the hole. With that particular extraction, you can see there's also a hair there, and that's a contributing factor. A very significant contributing, complicating factor to the formation of pimples. And so sometimes you'll see the hair that's coming out of the pore, and sometimes you won't. But in any event, you can kind of see, let me clean that up for you, you can see that pore is just empty. Just an empty hole. And so I know that it's cleaned out. You cannot do this on yourself. It's just impossible. You can't get a good straight-on view. So I just press. You can see that the stuff inside starts to extrude. And I press again. Patients don't necessarily like this part. It's not particularly comfortable. But by pressing down on the outside, around the opening of the pore, what we're allowing is we're allowing what's inside the pore to come out. In this case, I'm going to actually open up that little opening of the pore a tiny bit wider. Just make it a little bit easier for the hard collection of skin cells that's inside of that pore to come out. And I'm going to come back and press again. And sometimes you can use the other end of the extractor. Press again. And it's almost like milking. There you go. Now it's coming out. That's all the infected tissue. There are the skin cells, the dead skin cells that were inside of the pore coming out. That's a hard, solid mass that's got the pore plugged. with all of the rest coming out. And you can see already the surface of the skin is much closer to being consistent with the surrounding skin. And we're just going to make sure that everything's out of there, which I can tell looking at it, it isn't quite. So we're going to keep sort of milking it, pushing everything over towards the center.
Is there ever a case where you can't get it all out?
There are occasions, infrequently, and there's some more. The milky stuff that comes out is all infected. There are rare occasions when I can't. When I can't, I know it. And a lot of times I'll come back and I'll use our device again to see if we can pull anything more out. And if we can't, the device not only extracts and extrudes what's stuck in there, but it also kills bacteria and damages the glands that produce all the oil that gets stuck in there as well. So we know that what we're doing is we're lessening the condition that's collecting underneath the surface of the skin. And you can see, I mean, I'm just pushing out what's collected inside of that pore. And you just can't do this to yourself. Your brain won't allow you to do this, and you can't see it well enough on your own skin to manage to do this. So you really need to let somebody who knows what they're doing it, do it to you, or you're just going to make your whole condition much worse. I typically at this point, when I know that there's still a little bit more in here, let me move this aside, I'm going to come back with the device, and I'm not going to use my light on her skin again. I'm going to turn the light off, and I'm going to actually just use the vacuuming component of the device on here and see if I can't pull out more. So we come back, get a good look at it, see what it looks like. So it's weeping a little bit. I'm going to go over it and pull out more. That's all infected blood, infected oil that's coming out. We're going to make sure we get out everything we can possibly get out of it.
How will you tell when it's all cleaned?
There's a different consistency to what comes out of it. The more, I'm not sure quite what the right word is.
Like that blood looked different than what just came out before.
Exactly. It's the consistency of the blood, and when it looks like regular blood, then you can be pretty sure that the pus is gone from the lesion. And in fact, usually when pretty much everything is out, it will almost stop bleeding on its own. And then at the end, when I'm pretty comfortable that everything is out, I will give it one more shot with light, because in effect what you're doing is you're helping the wound inside to heal. It's almost like putting a bovie in there and using a little bit of electrocautery to seal up that wound to help it to heal very quickly.
In English, what does that mean?
That means that we're delivering some significant heat to the area. We're sealing off the wounded tissue so that it can heal quickly. Okay? And that feels a whole lot better, doesn't that? Doesn't that feel much better?
Mm-hmm.
Sore from the extraction, but much, much better, not that deep pain. Yes?
Yes.
Okay. So I'm going to add back in the light. Hit it one more time. And that one is done. And as you can see, the tiny little one above it that I just did before this looks like it's almost completely resolved at this point.